The chief clinical officer for Texas Health Resources is apologizing for a Presbyterian hospital making a mistake and misdiagnosing Thomas Eric Duncan, the first Ebola patient here in the U.S. Now, this admission comes after explosive allegations were made against the hospital by the National Nurses Union. They claim a lack of policies put nurses as well as other patients in danger. Fox 4's Calvert Collins joining us now from Presby with details of what nurses say happened during Duncan's treatment. Calvert.
And Heather, some of those details are very graphic, even difficult to listen to. But these were allegations made by nurses spoken in confidence to the National Nurses Union. But they severely contradict what Presbyterian Hospital administrators told the media 3 weeks ago about how prepared the hospital was for an Ebola patient.
Nurses had to interact with Mr. Duncan with whatever protective equipment was available at the time when he had copious amounts of projectile vomiting, diarrhea, and other bodily fluids coming from his body.
Gruesome details emerged from the nurses who treated and observed Thomas Eric Duncan. They confided in the National Nurses Union that they had received no mandated Ebola training. The CDC guidelines changed several times, and there were no policies for cleaning and bleaching. In a teleconference from Washington, D.C., the union also cited cross-contamination hazards.
Lab specimens from Mr. Duncan were sent through the hospital tube system and instead of being specifically sealed and hand-delivered to the lab. The result is that the entire tube system, which all lab specimens are sent, was potentially contaminated.
The union alleges Duncan was left unattended for several hours outside of isolation. And in the early days of his treatment, nurses say they wore generic gowns, 3 pairs of gloves with no taping at the wrist, surgical masks, but no surgical booties. CDC Director Tom Frieden described variability in what protective gear Presbyterian employees wore. Some had 1 or 2 layers on, while others had 3 or 4.
These are good, dedicated people who worried about themselves and their families, and they were trying to protect themselves better. But in fact, by putting on more layers of gloves or other protective clothing, it becomes much harder to put them on, it becomes much harder to take them off. And the risk of contamination during the process of taking these gloves off gets much higher.
Duncan's medical records released to the Associated Press show Amber Vinson inserted catheters, drew blood, and dealt with his bodily fluids before he died last week. Officials say Nina Pham's and Vinson's Ebola exposure came from a breach of protocol, but the nurses union argued there was no protocol. There has been very little transparency. Texas Health Presbyterian Hospital clinical director stopped short of conceding mistakes.
We're a hospital that may have done some things different with the benefit of what we know today, but makes no mistake, no one wants to get this right more than our hospital. The first to diagnose and treat this insidious disease that's now attacked 2 of our own.
President Obama met with his cabinet to discuss deploying an Ebola response team when other patients arise and arming hospitals across the country with more training and protective gear.
We are reviewing every step of what's happened since Mr. Duncan was initially brought in to the hospital in Dallas so that we understand exactly where some of the problems may have occurred.
The nurses strongly feel unsupported, unprepared, lied to, and deserted to handle the situation on their own.
Well, it's unknown if procedures changed between the care for Thomas Eric Duncan and Nina Pham. No one from Texas Health Presbyterian returned my calls for comment, but Nina Pham is still listed in good condition, and so far none of the contacts, both from Thomas Duncan, Nina Pham, and Amber Vinson, are showing any symptoms of the Ebola virus. Heather?
All right, so Calvert, we mentioned that Dr. Varga is apologizing for Presbyterian's mistake. That will officially happen tomorrow at a congressional hearing. Any insight at all as to what else he's going to tell Congress tomorrow?
Yes, well, his testimony has been published online, and again, early on says that there were mistakes made and that there was inaccurate information disseminated to the public, causing more confusion and more unsettling, causing some potential hysteria. Interestingly enough, when Thomas Duncan first went to the emergency room on September 25th, he had a fever of just over 100 degrees. During his time in the ER, that spiked to more than 103 degrees, then decreased, but he was discharged still with a fever. Dr. Varga also admits there does need to be more training, but the screening process for any potential Ebola patient now includes, among the first questions, is a travel history and just some other training procedures that do plan to be enacted if they have not already done so.
All right, and that again is taking place tomorrow. Calvert, thank you.